How many people have really died of COVID-19 in Ireland? The official death toll as of earlier today was 1,772. However, most people who have researched this subject in more detail understand that there are questions around this number. For example, the former Chief Medical Officer of Ireland, Tony Holohan, said that anyone presenting to hospital with COVID-19 who subsequently dies, regardless of the cause, will be included in the mortality total for the virus, in line with World Health Organization guidance. So just to be clear, the 1,772 number includes people who died of other things. And the former Prime Minister of Ireland, Leo Varadkar, has acknowledged that, quote, "We counted all deaths in all settings, suspected cases even when no lab test was done, and included people with underlying terminal illnesses who died with COVID, but not of it." He made these remarks in response to a report by the Health Information and Quality Authority, which found that excess mortality for the period from 11th of March to 16th of June was only 1,072 deaths, with a confidence interval from 851 to 1,290. So that number represents the number of extra deaths during the period compared to what would normally be expected, and it represents extra deaths by any cause. So that is all-cause excess mortality. And that number, 1,072, is less than COVID-19 related reported deaths, which means that it is hard to conceive of a scenario in which that COVID-19 official figure could possibly be true. Now, I have been examining this myself, and I have contacted the General Register. So I have the deaths registered legally in Ireland as of the 31st of July 2020. And here they are. These are all deaths by all causes registered in Ireland. Now, it's important to note that you generally have 3 months to register a death in Ireland. And so these numbers are not final. I will not use the numbers for June and July. However, I will focus on the number for April, because more than 3 months have now passed since all April deaths as of the end of July. And I will also make some reference to the May deaths. And I'm going to make some adjustments to these numbers, which I'm about to explain. But firstly, let's look at these monthly deaths. So as you can see, April 2020 in red on the left was a bad month for mortality. May 2020 was a good year with fewer deaths, but of course that data is not complete. Not all May deaths have been registered yet. And I also need to adjust for population size, which I'm going to do shortly. But just to show you all of the monthly deaths in a chart, you can see that April 2020 was a bad month. And you can see that January 2017 and January 2018 were also very bad months. I do not currently have months from July to December, so these are only January to May. But you can see January 2018 and 2017 were bad. January 2016 was bad. And you can see that April and May on the right-hand side for these months and years were not so bad. Now let's look at cumulative deaths for each year. So this just takes the raw data from the table you saw before, and it adds up the deaths each month. So the number at the end is all of the deaths registered by May of that year. And you can see on the left-hand side that January and February were quite mild for 2020, but that when we get into April, the blue line, which is 2020, catches up with the other lines. And by the end of the May month, 2020 is no longer the lowest year for mortality. It's here, so it's not the lowest, but it's well below 2018, which was the last year we had a bad flu season. Now, as I've just mentioned, there were two adjustments which I felt were important to make. The first adjustment was to account for the fact that not all deaths have been registered yet at the General Register of Ireland. So what I have done is I have used two data sets, one for the end of July and one for the end of June, and I've made a rough estimate as to how many future deaths I expect to be reported and recorded for 2020. Another adjustment I've made is by using the population of Ireland, which changes over time, and I have adjusted for historic population numbers. So using those adjustments, I can show you monthly deaths in Ireland per 1,000 of population. And these are the numbers that I expect will be valid when the 2020 numbers are complete. So there are some adjustments needed to the raw data, which I've made. And on the basis of those adjustments, I think that in the fullness of time, we will find that April 2020 was probably in the region of January 2018 and January 2017 for mortality. So if you like, this is the risk of death per 1,000 people for the month. I also have adjusted the May 2020 number upwards for the future registrations I expect for that month. And you can see that it brings it more in line with May 2017, higher than May 2017, in fact, and not too far off May 2019. So May becomes a more normal month. April 2020, clearly unusual. However, not worse than January of 2 and 3 years ago, respectively. Now I can show you the cumulative deaths on the basis of the adjustments that I've made. And so this again shows the mortality in Ireland per 1,000 people from January to May. So I have found that my 2020 estimate is very much in the middle of the other years. And again, if we go back to January, you see that 2020, the blue line, started off with very low mortality. And then from March to April, so to the end of April, we had a large increase in mortality. and then May was normal. So the sum of these different effects is that we end up with a normal year for mortality. If I can find the actual number here, we have roughly a 3, just below 3 per 1,000 chance of death per 1,000 people, and 2020 is very much in the middle of these estimates. Now let's focus for a minute on April 2020, because that was an unusual month. It was not unusual versus Januaries that we've had in recent years, but it was unusual versus other Aprils. And you can see here that the other Aprils in the data set had lower mortality. Now, I believe that it's extremely important to account for the effect of lockdown itself, because during lockdown, the use of the healthcare system collapsed, and this resulted in other deaths not caused by COVID, but caused by simply people not using the healthcare system in the way that they normally would. So just to drill in on what I think the excess deaths were, based on the historic patterns for April, I believe that you would have expected just over 2,600 deaths. I believe that the actual number of deaths in April 2020 is something around 3,600. So you have 970, or let's call it 1,000, excess deaths over the normal amount that you would expect. And that is worth investigating. Now, in the UK, the Office for National Statistics, with other government bodies, has attempted to estimate the non-COVID deaths caused by lockdown and changes to the healthcare system. So you can see changes to emergency care, they believe, caused 6,000 excess deaths in March and April. Also, they expect 10,000 excess deaths were caused by changes to adult social care. So that adds up to 16,000 non-COVID excess deaths caused during lockdown in England. Now, I cannot do a more detailed analysis myself with the resources currently available to me in terms of analyzing what specifically happened in the Irish healthcare system in terms of A&E attendance and changes to care homes. But I know that the policies in Ireland were quite similar in terms of A&E attendance collapsed, doctor attendance collapsed, people left hospital early, people were reluctant to go to hospital if they felt sick. All of these things happened in Ireland as well. So what I have done in these two boxes is I have calculated how many non-COVID excess deaths occurred in England per 1,000 population. So this is as a result of lockdown. And I've simply translated that to the Irish population. And I'm only looking at April. So remember, I'm investigating the month of April. So April had 30 days. And I'm doing a translation from the ONS report where there were 46 days of lockdown in the period covered by the ONS. So please feel free to look for errors in my calculation, But I think that it is a reasonable estimate, call it a back of the envelope estimate, but it's something we could use to anchor our expectations. Something like 900 deaths may have been caused by lockdown in Ireland in April 2020. And if I can then show you what that would mean in terms of COVID deaths, you'll remember that I thought there may have been 970 total excess deaths in the month of April. My translation of the ONS estimate for England would result in 915 or 916 deaths caused by lockdown, by changes to the healthcare system. And that would leave only 55 deaths caused by COVID-19 and other. And other could include other elements of lockdown. It could include the demographics of the country, specifically in April 2020. Obviously, the distribution of the population at the very older end of the spectrum determines likely mortality month to month. And there could be beneficial effects in there as well. So, for example, if the weather was fine, that may have saved people, and therefore that would mean that the impact of COVID was worse than simply this number, 55. There's a lot of effects that are difficult to map and which somewhere go in here. And of course, there's also a huge uncertainty around how many deaths were caused by the lockdown itself. I think that 900 is a good first estimate, but I hope that other people will research this in a lot of detail. People who have a lot of granular detail about doctor, GP appointments, A&E appointment admissions, and so on. But I suppose my conclusion, and I'm going to pull up this chart here as I talk about my conclusion. My conclusion is that it's not proven that COVID-19 was responsible for a large, let's say, number of deaths. And of course, every single death is tragic. If you want to understand the macro situation, you have to put it into numbers. And so I think it's reasonable to say, on the basis of these numbers, that it's not proven that COVID-19 caused a large number of deaths. Certainly, it's not proven that COVID-19 caused more deaths than you would expect in a flu season, for example, and certainly not more than you would expect in a bad flu season. Now, many experts believe that the death toll from COVID-19 could have been much worse. And indeed, the ONS, using Professor Neil Ferguson's model, believes that the lockdown saved hundreds of thousands of lives, and that in the absence of lockdown, you would have had over 500,000 COVID-19 deaths in an unmitigated, reasonable worst case scenario. And of course, in Ireland, that number was translated to be around 89,000 or so as a reasonable worst case scenario number of deaths. So many experts do believe that there was an extremely deadly virus here and that it is still here. However, the empirical data, in my opinion, does not show that there was an extremely deadly virus on this island in the Republic of Ireland. And I believe that if you look at other nations, you will also struggle to find evidence based on all-cause mortality, that there was a killer virus. So I'm just someone who likes to look at empirical data. My view is that it's not proven that a killer virus exists based on the data that you can see right now on the chart. But I could be wrong, and I am open to being proven wrong, but I think we should be guided by the actual data, and we should use data responsibly and effectively. And we should focus on empirical data more than we rely on theoretical models. So that is my view, and I hope you found this interesting. Please do let me know if you find errors or if you can improve my estimates. Thank you.